Big Tent. Our special topic is centered around member outreach and provider engagement. Now that we're past the interim final rule and have a lot of clarity around the policy, we feel more confident about how to help prepare our partners with speaking about all of this and preparing our members with navigating these changes. So we're going to do a couple of slides dedicated to that. And then we also wanted to provide you some updates with some of the key activities the state is undertaking, continuing to prepare for implementation. We don't anticipate this is actually going to take the full hour, so we certainly want to save some time for everyone on the call, our partners, to bring forth additional discussion topics, questions, concerns, requests, anything that may be top of mind for you, certainly welcome. All right, so where we are, it's been a couple of weeks since we last met, I think about 3, 4 weeks ago. Since then, some additional updates have materialized. So from the policy front, the state has concluded at this point its thorough assessment of the interim final rule, impact of that assessment on implementation planning, and at this point has secured all of its state deferred decisions that CMS has deferred to states to make. So at this time, the state is not pursuing short-term hardship exemptions for initial go live. That doesn't mean that may not be revisited in the future, but for at least this initial go run, they're not being pursued at this time. Medical frailty. So as we know, the interim final rule introduced a bit of a complexity with operationalizing that exemption. Not only just a quick refresher, not only does the individual have to have a medically frail condition, but that condition needs to be severe enough that it precludes them from actually participating in any of community engagement activities. So it's severe enough where work, volunteering, participating in an education program or work training program is too difficult. So we've been working closely with the state and monitoring other states and kind of how they're tackling this as well, in terms of how to get that second component. We have the conditions and a good handle on the conditions, but how do we determine severity of condition? So we've been evaluating different evidence-based, CMS-approved functional assessment tools that can accompany that condition, to be able to, again, determine that severity and ensure that those who meet those conditions obtain that exemption. So all of that's underway. We've been working closely with our MCO partners to evaluate opportunities to conduct those functional assessments with existing members, and are exploring opportunities to be able to do the same with applicants. So we're still a little bit in the early stages. A lot of states are humbly navigating that new requirement, but that is where we are at with that. Presumptive eligibility as well is a complicated piece. So the interim final rule does specify that qualified entities who are qualified to perform presumptive eligibility reviews will be required to also determine whether that individual may meet an exemption or qualify or are compliant. So that is a bit more complex now, of course, with these new requirements than it was previously. So the state is looking at developing updates to that screening tool that are available for qualified entities to be able to perform that assessment a bit more confidently. So all of those discussions and activities are underway. We do have planned late fall a dedicated special Big Tent topic on presumptive eligibility, and we'll be working to make sure that all of our qualified entities are aware of that and can participate in that. So we have opportunities to do some re-education around presumptive eligibility and talk about the anticipated changes with these new requirements. So any questions on policy updates? I'm going to keep rolling on forward then. So where we are at with systems, we're making great progress with enhancements that are being made to the People's Access to Help Path portal that's used for enrollment and eligibility. We are also making great progress with the integration of that community engagement application called Verify. That is a Citizen Government Solutions application that will be integrating with PATH and ensuring that is a nice seamless experience for our members who have to to use those platforms. We do have a little bit of an ask here because we anticipate that our members will probably be engaging with these systems more frequently and perhaps a little bit longer than they have historically. We feel very strongly that it is important we bring Medicaid members to the table to be actually be able to interact with these systems while they're in development to ensure that what we think is user friendly is in fact user friendly for those that are interacting with those systems. So we do have a request. We are working through the state's Beneficiary Advisory Council to recruit members to be able to participate in that system usability testing, but certainly putting the ask out to our MCO partners should you have formal advisory councils as well as the rest of our community partners who frequently interact with Medicaid members to please help support us in making sure we can get more Medicaid member voice to the table. We're going to be pulling together a formal communication and invitation or way for you to be able just to kind of forward that information on for confidentiality reasons and give the member opportunity to opt into that testing. So more on that forthcoming. Where we're at with the referral network. So West Virginia 2-on-1 has worked closely with the state to confirm that they will be providing support moving forward with building the referral network, continuing to build referral network, and ensuring access to volunteer opportunity as well as service support opportunities as well, because we know just because the opportunity exists doesn't mean it's accessible. So we are continuing to look at that from both perspectives there and working with collaboration with Citizen, who will be the closed loop referral component as well. So we're working to build that out. We anticipate the system likely will not be fully implemented by 1/1/2027, but we anticipate within the first or second quarter shortly thereafter that'll be functional. We are also working developing a specific toolkit for nonprofit providers, which will be a little bit different than the one you all are receiving in terms of how to navigate conversations with members. This one will be specific for how nonprofit providers need to be prepared to help support members who may need access to some of these activities.
I have a question. This is Benita Whitman.
Sure.
I'm sorry I couldn't click fast enough. It's about policy. Should I wait to the end or ask you now?
You can ask now, Benita. Please feel free to.
Thank you. My question was about the looking at evidence-based tools. Could you speak a little more specifically about that? Is there a certain company's tools, something a little more in depth, if you could?
Yeah, Benita, I would be happy to. So one of the functional assessments we're looking at is called the HUDAS tool. It's a World Health Organization evidence-based tool. I think it was developed in the early 2000s. It's gone through a couple of revisions. It started out as a 36-question functional assessment. The most recent version is a 12-question assessment. So we wanted to make sure we were looking for assessments that were not lengthy, difficult to answer, and the type of and this is a CMS approved tool. Not for this purpose, I should clarify that, but it is within their toolkit of assessments that they've I don't want to say promote or endorse. The right word's not coming to me. But we did want to make sure that we were, yes.
Natalie, I'm sorry, I didn't get that name. How do you spell? Is that WHO or?
WHODAS. HUDAS. And I'm happy to send a link out as a follow-up after this meeting if that would be helpful.
Okay.
I just put a link in the chat.
Thank you, Shelley.
What purpose is it approved for by CMS now?
Yeah, I don't know that they've specifically listed instances where they would approve it. I think they approve it from the sense of, for being able to determine difficulty with daily living tasks. When you look at the questionnaire, it does specify like it asks plain language questions around like, do you need assistance using the restroom? Do you have difficulty doing this? How often do you have difficulty doing this? And those types of pieces. We're still in the very early stages. There's a couple of different tools we have been looking at, but that is the one that we're hearing more frequently that other states are looking at as well. It kind of seems to be one that is, I don't want to say trending, but we are seeing other states looking at that one as well. And some preliminary clinical reviews of that assessment, we're starting to see some agreement and alignment that that could be the right way to go. Did that answer your question, Benita?
Yeah, yes. I will follow up out of this meeting about this issue.
Sure.
Thank you.
Of course. Okay. Thank you for that question. So, Kate, I picked up with caseworker readiness. So, again, now that all of the policies kind of locked in, we can move forward full steam ahead with finalizing training development and content development for trainings for the caseworkers and call center staff. There is a live session that's going to be planned for end of August, early September, and we've developed a series of micro learnings that will be asynchronous trainings that caseworkers will go through. So, we're beginning with the context, building knowledge around the program, the policy, the requirements, to give them that good foundation before we head into systems training, which will be later, starting November, December. We'll train them on the systems and then bring those two pieces together for scenario-based training that will see us from go live through next year as well. And then our outreach partner readiness pieces, which is the focus of today. We've developed some materials to support our outreach partners, our trusted voices, who will be out in the communities interacting with members and supporting the state with consistent communication of these changes and support with navigating these changes. So we'll do a little bit of walkthrough of some of those materials, as well as talk a little bit more about the partner portal that has been developed and available for all of you to be able to use moving forward. So the focus, we've begun communication to members since May. We've been communicating with members in different ways since May. The primary goal of these initial communications is to just build awareness that changes are coming and some preliminary education around what those changes are. Again, now with the release of the interim final rule and a lot more clarity around the different definitions of requirements and what is expected, what counts, what doesn't count, we're able to continue to build off of that awareness foundation and continue to develop more education and more urgency to be prepared to take some action. The state, again, has also opted into a CMS early awareness campaign. So this is a campaign that CMS has offered to states. It is a 2-month, runs from July through August campaign. Series of text messages and emails to support states with that awareness and education. And then we have the first formal notice that's federally required, and that's slated for August. Strategy is first and foremost making sure that very consistent language, plain language, in all of the messaging. So these are very complicated requirements. They can be nuanced and they're plentiful. So we've been really thoughtful in thinking through how we can communicate things clearly, communicate things consistently, and repeat it over and over and over to ensure that we're not only sending email, but folks are reading emails and comprehending some of these changes forthcoming. And that last piece there, multiple modalities, so making sure we're hitting all the different ways folks receive information, and making sure that we are aligning our efforts with all of the trusted voices within communities, as you all are, as well as the governor's office. Just listed a couple of key partners who's been behind the scenes in supporting the development and implementation of some of those communication activities. We do have, you'll see a little icon in the upper right corner there. We do have a couple of poll questions or just questions that we're going to throw out throughout the next couple of slides here, and our first poll that we would like to ask is that you can please share with us your name, what organization you come from, and your role. That would be really helpful. We want to continue to be really intentional to make sure that we have broad and comprehensive representation in these meetings. So just be really helpful to just learn more about who's on the call today and who you're representing. So if you wouldn't mind taking a moment and adding that to the chat, it would be, is that a chat one, Laura?
It should have popped up on screen, so I see some people are answering it as we go.
Perfect.
We'll keep
Thank
that
you.
one open for a bit.
Thank you. Yeah, really appreciate your participation in those. And with that, I'm going to turn it over to Shelley, who's going to walk us through the toolkit materials.
Thanks, Natalie. Um, as she touched on, we've been working on communications and disseminating communications since May. We're taking a three-phase approach with this, trying not to overwhelm members with information at first, especially as states are just rolling out this implementation. So we launched an informational website. That was the first step that we went to, so people would have an area to get that very early information once they heard about the changes. Now we're kind of in the middle of that strategy and we're ramping up communications and outreach. So moving from that awareness to more active messaging and frequency. So this is a little sampling of what we've put together for our phase one. So that informational website, like I said, and then an announcement postcard that had really high level, brief information that the changes were coming, what they could do in the meantime, that the Department of Human Services is here to help. So we also followed up that messaging with an email sent out to members that reiterated that same message. So just doubling up on that language and followed through with robocalls as well. And our most recent mailing was an informal letter, but more detailed than those first iterations of communications we sent. So this one got into more of who the rules apply to, qualifying activities, and exemptions. So the web performance, that website that I talked about, we've discovered that with those iterations, we see a bit of uptick in the site. So we've got that robocall to members on June 16th, and then it starts rising. The biggest spike came from when the Bureau for Medical Services released a press release just announcing the changes. And what's encouraging about this is their press release directed people to that external site. It's called wvmedicaid.org. And a lot of people, you see the highest numbers are going to, the homepage, but then also our screening tool. It's called Will This Apply to You there if you see that number. And it jumped significantly from, 27 users to 4,000. So that was really encouraging, and we're going with that. We are for our next iteration of messaging, we are still encouraging people to visit that screening tool to find out if they will be affected. So this outreach partner toolkit, this was for DOHS staff, other community partners, MCOs. It had copies of those mailed materials that I just touched on, as well as a full flyer encouraging people to use that screening tool. Things like FAQs and scripts were included as well. And that was just our first iteration of the toolkit, and they will continue to be built up and added to as the months go on. So for this one, we did want to know through a little poll if anyone on the call had seen this toolkit. Have you used the screen? So with that web data, we can see where people are accessing that tool, but not who. Is it caseworkers? Is it staff? Or is it a member actually using that tool? So just this little bit of information gathering is really helpful. So now we're going to get into phases 2 and 3. So where we're going in the months ahead. So, if you haven't been aware, CMS is also launching their own early awareness campaign for certain states that decided to opt in. Something we learned from meeting with regional program managers is they really wanted to get a preview of what CMS was sending so they could be prepared, so they could be sure to tell people that, it's not a scam when you get these texts or emails coming through. So we just wanted to share what we have received from CMS, so you would have some idea of what to prepare for or what you hear about coming forward. To my knowledge, they should have disseminated the first email and first SMS message sometime between July 1st and July 20th. So if you've seen any of those, feel free to let us know in the chat. We're curious how they've been received and how widely they've been shared. So yes, phases 2 and 3, we are working on a formal notice that will go out in mid-August. So this one gets more detailed, has more direct wording, I feel, and correct me if I'm wrong, Natalie, from the policy. So the most information we've shared so far, and it's, coming from trusted voices. So taking it out of that informal messaging and saying, this is from the state, here's what's happening. So instead of changes are coming, we're kind of shifting that message to preparing for those changes. And also, we've got more of this on the ground materials here, but as we get into those other phases, social media will be more of a factor. So just giving a preview of the Department of Human Services YouTube channel there, where we will have information, and their Facebook as well. So, Outreach Partner Toolkit number 2. So, this is currently going through some reviews and refreshments. It will include all of those things that you saw previously, so you have a good repository of what members are seeing, but it will include more materials now as well. So, we've updated the frequently asked questions, scripts, and we've got other materials planned as well that you can see here, posters, rack cards. I'm not sure if they will be mailed, but they will be sent out in these toolkits and also in the partner portal that we'll talk about. Partner portal. So this is one of the latest features on wvmedicaidhelp.org. So we've got a little coming soon there. The downloadable community engagement playbook, plain language recommendations, the outreach materials, and everything I touched on, they will be there, able to be downloaded in PDF form. So currently, you can see at the preview there, we've got that first toolkit iteration, and then a section on that resources and partner resources. We put these recordings there as well. So if you want to touch on any previous meetings that you've missed, those are uploaded from the DOHS YouTube channel.
Yeah, and the only thing I'll quickly add to, and Shelley, if you already mentioned this, just want to repeat it once more too. All of these materials that we're kind of previewing with you right now are being routed through that final review process. We anticipate that'll be completed pretty soon. Just a couple of levels we have to go through. As soon as we get the green light, all of these materials will be uploaded to this portal that Shelley just talked about, and we will make sure that we send a communication out to the whole group, letting you know that those are now available for download. Yeah, and Sherry, that's a great question. So yes, the materials that you actually see will be the same across all of the different types of toolkits. Where you will see some variability in some of the resources is we did develop some specific scripts that might be different depending on the type of partner you are. So we did try to be thoughtful about tailoring some of the scripts and even tailoring some of the FAQs, just thinking about some of the interactions that someone in a healthcare setting may be having with a member versus someone that maybe is a little bit more of a navigator or advocate. So we try to do more than less, and leave it up to you to kind of comb through the different options to see what is the best natural fit for you. But yes, all of like the visual materials, the flyers, the postcards, the wrap cards, those are all going to be the same resources for all members. And I know we've received some questions in the past about, can I develop my own materials? And we're not going to be the police on that, of course, and we can't be everywhere, but we of course just really encourage in the spirit of that consistency in communication, and ensuring that we're supporting that member with receiving consistent communication, that material be used kind of exactly in how it's been prepared. Again, this policy can get a little bit of nuance, and a good intention change can really change the meaning of it. And we are happy always to support partners with looking at things if you are developing materials or those types of things, and wanting us to take a peek. We're happy to do that and provide that support.
I appreciate that, Natalie. I think where we had talked about a provider toolkit and different things previously. So if it's one area and then we choose whatever we need, that's fine. It's just when can we begin communicating that out? Folks, for example, we had a health center in the northern part of the state. 11 patients this week called them saying they lost their Medicaid. So there's some confusion maybe with maybe some of the information being received by current beneficiaries. So that's where if we had some things already to them, maybe they would feel a little more prepared. So that's why I just want to make sure that however we respond, it's correct, number one, and making sure we're telling people the right information and where to go.
Yeah, absolutely. And I appreciate that, Sherry. That is the type of context too that is so helpful for us, because sometimes we develop these things relatively in a vacuum, and hearing directly kind of some of the input or feedback you're hearing and some of the questions you're fielding really help direct us to inform some of those FAQs and inform some of those scripts. And I do feel we have that covered, good news, and what we've developed. But yes, as I mentioned, and when I say toolkit, it's not going to be like, click this to download the provider toolkit.
Right.
Yeah, we have this partner portal that's going to give you the opportunity to like filter provider, right? And you'll be able to say, these are all the things that might be provider relevant and those types of things, and pick and choose what you want. But we are so close. Things are routing through final approval. As soon as we give that blast out that they're all loaded and ready to go, feel free to. If you are, needing to troubleshoot in the interim, feel free to just send us those one-off requests, and we're happy to help kind of quickly get you some feedback to disseminate out too.
All right. Thank you.
Of course.
Natalie, this is Benita. I would like to add another comment about Sherry saying people were told they were losing their Medicaid. I was told of another example of someone who was told that in January they were losing their Medicaid, and it had to do with activities they were doing. And I'm not sure why that would be talked about now if you haven't trained the workers. It appeared this was a review, and it's not clear if that was accurate or not, what materials were being used. Have materials gone to the caseworkers in the local offices yet? Have they gotten something?
Yes, they have, Benita. So that they have received a toolkit. We released that to them back in early May, if not late April, that we anticipated our caseworkers were sending out postcards, we're sending out letters, we're calling, we're robocalling. Of course, we anticipated that we needed to prep some key stakeholders with it to handle inbound support. So our caseworkers, our call centers, all received a preliminary toolkit with some guidance, some FAQs, some scripts, to help navigate some of those calls that folks might be completing once getting that postcard. So we did do that. That was shared in addition to our caseworkers and call centers, also with our MCO partners, just thinking through other, you know, excuse me, sorry, bad allergies. Just thinking through those partners that are, fielding a lot of that inbound support. But again, this feedback is really helpful. These give us exact scenarios and exact type of questions or areas where confusion might be continuing. So we can continue to be thoughtful about directing communications or creating additional resources to be very clear that says like, no changes are happening now, those types of things. So this is all really helpful feedback, and we do appreciate you taking all the time to share it.
If I can add to that. So, if it was a conversation, we're not really sure what could have been said, what the direction was. They may have said, you may need to do something next year. It looks like I don't, today we wouldn't have enough information to know whether or not they'd be compliant or not. But we've not changed any of the notices that are currently being sent out. So if you could get a copy of that, it might be easier to explain what was actually going on in that situation. But there shouldn't have been a formal notice that would say any differently. Now, there's been informal letters, that have gone out that Shelley said, but they're not even directed to a person. Right now, it just says West Virginia resident, because we didn't want it to, cause this confusion right now. So knowing that it may have, inadvertently, but there's been nothing that should say, as of January, you're not eligible or anything like that. So,
Sarah, thank you for that, and Natalie. And it could just be maybe someone didn't take time to read it thoroughly. Maybe all the things that we know
Yeah.
that happen. But I found it kind of out of the it was not normal for 11 different patients to call and say, I've lost my Medicaid. So then that makes me think, okay, so there's a misinterpretation somewhere. So that's just wanting to flag that. And then if I can ask what and I don't even know if it's the same document it should be with all 11, but at any rate, I just wanted to raise that, but I appreciate that clarification, and I'll make sure that the health center is aware.
and it is the end of the month. So, that is when those notices go out officially, that we have to give members 13 days notice. We have to give them 10. We give them 13 for mailing days, but it could be that coincidentally all 11 of those,
Yes.
miss their renewal, or, something, but we'd always
Okay.
be happy to look at that. You can either direct them to our constituent services, or if you want to send those to us, we could look at that and see, if there's a glitch or something unrelated. But we'd be happy to look into that.
All right. Thank you.
Sure.
Yeah, and just, continuing to hear, like, we're not sure what they saw. In addition to the pieces we shared today, you will also see in that partner portal anything that members have received. So, if you have someone call in, they'll be able to say, like, I got this letter in the mail. That would allow you all to pull up that letter and say, well, let me see what you're seeing. Let me see what you're reading where it says that. Oh, let me help you kind of explain that a little bit differently. So
Oh, yeah, that's great.
we're going to
Yes.
be intentional, but anytime a direct communication goes to a member, it's going to get added to your partner portal.
All right. And you said we can be in the partner portal now, though there are still updates happening.
Yeah, there are some materials that have been approved and it's
Okay.
just a little light right now. The
Awesome.
bulk of what we shared with you today, you can absolutely scan that QR code. It's going to ask for, we did put a light gate on it, nothing too crazy, but we did put a requirement to give us a name and an email. That helps us also monitor who's accessing and
Sure.
those types of pieces. But there are a couple pieces in there. But soon again, as all these materials get reviewed and finalized, we'll continue to add to that and let you all know those are available.
All right. That's helpful. Thank you.
Of course. Yeah. Any other questions? It's all really great feedback, great discussion. Okay, great. Anything else on this slide, Shelley, or go to the next slide?
I was also just going to say in these materials going forward, lessons learned from phase one, we found that, not everybody knows what exactly the adult expansion group means. So we were, careful to list out those health plans that people might be more familiar with that those names. So MCOs that are on the call, you might be hearing more. If you have anything specific that would be helpful for the toolkit or that you find confusing, we have a slide coming up with an email that everyone on the call can use to get in touch.
Okay, and this is just to kind of continue to keep in mind who we have. This is just an example. It's not a comprehensive representation of all of the partners and all of the trusted voices that are out in the community meeting folks where there are, but this is how we are continuing to think through development of communication strategy around how we're developing, keeping our member at the center, and looking at that support network around them. So just to kind of contextualize further, Sherry, that toolkit we mentioned, that's already been in circulation with some key partners is this cohort over here who has had material for a few months, at least preliminarily to get them started. And those two to three other toolkits that are forthcoming are going to help this group. So those that are going to have to be prepared to provide members with access to opportunities to be compliant, and our community-based partners as well, to support with that consistent communication with these changes. So if it's helpful to see that ecosystem and how we continue to kind of think through this. How you can help, you all have already been helpful just by coming off mute and talking is so helpful. We appreciate that. Chatting questions is really helpful. You are eyes and ears on the ground. So we love that feedback. Again, it really helps us understand what's working, what's not working, and where there's gaps. We are going to be moving into more targeted social media, and working on building out those campaigns and accelerating the frequency in which we're, I don't want to say flooding, but yeah, beginning to kind of flood, right? A little bit, and making sure members are seeing this in different ways and that it is consistent. So we ask, those campaigns are going to start running soon. So we ask all of you, please, to the extent that you can, make sure you're following DOHS channels, and resharing that content with your groups, and your networks as those kind of come out. It helps to continue to spread that campaign message wide and far. So just wanted to put a little plug there. We'll also be resharing all that content as well, just to kind of keep extending that. So there are a couple links here. You'll get the slide deck too, so don't feel like you have to quickly write down or anything like that. We'll send out the slide deck with some of these. And to Shelley's point, we're happy to take questions. We're happy to take requests. We have set up a dedicated email box where we can field some of those questions. It's West Virginia Medicaid Changes at hsc.wvu.edu. So as you start to hear these things, Sherry, coming out of meetings with supervisors or staff, and you're hearing these things, feel free to shoot us notes, questions. We're happy to kind of triage those as they come in. But questions. Any questions or requests? I know Ayla, you pulled up a question from earlier. I didn't want to dismiss it, but I wanted to have some question or dialogue around it before we answered it. So can you talk to me a little bit more about how those micro learnings and beneficial for community partners?
Absolutely. So, in a lot of what I do is listening, just out in the community. I serve 32 counties. It's a lot of counties. But in that, I'm in a lot of meetings with a lot of different people, right? And often where the community partners, are hearing things third hand, right? So maybe it's I'm relaying information, or maybe it's their client relaying information. But I guarantee you almost never is it the same information they're getting when they talk to their department worker, right? And that's a problem, because when they're out in the community talking to their, I don't know, caseworker with Health Right, maybe, then how does Health Right know what the correct information is? And I think that having different information and approaches, absolutely 100%. But something I wish I had when I was working with clients was to know what the department worker was being told, right? To know what their base understanding of these changes are, because then I can say, no, that is not what they said to you. Or, well, maybe maybe they didn't understand it correctly. Or maybe, if I know what they know in the same way, I can better assist answering questions or misunderstandings when they inevitably come to their community partner to say, hey, this is what I was told, much like the examples we had earlier, where, oh, well, if this is what our clients are saying, how do we respond? How do we help them over that hurdle? And if if they all hear the same thing at the same time as their department workers, then that there's a foundation to move forward.
Yeah, I think that's a good point, Hila. So I was kind of hung up. We have an official community partner setup that the individuals help submit applications. I wasn't sure if that was the angle, so I appreciate the clarification. So I think that we could look at modifying that a little bit. So the worker training is going to be like heavy in the weeds with the system. So on this screen, you enter this, and which I
Right.
don't know is exactly what you're looking for, but I think that as far as, to your point, the messaging and the basic understanding and maybe just some of the same terminology, that's a really good idea. I do think that our intent through this vehicle and through other, public meetings is to get that same message out, but it wouldn't hurt to see if there's a way we can strip away some of the system piece of it from the worker trainings and kind of make that a little more broadly available. Natalie, is that what you would agree?
Yeah. Yeah, we would be happy to do that. The other thing I wanted to, and I probably should have gotten into a little bit more detail of like the social media campaigning, is we do plan to develop like a series of short videos, little clips that like this topic is just work. What counts as work? What is medically frail, right? These like broken down explainer videos, if you will, that are a little bit more public facing that could resonate. It's a consistent message for both the member and the community partner that's helping them navigate that. So that's kind of our strategy for the social media campaigning, is to be able to leverage those kind of short explainer videos as well. But yeah, we're happy to adapt as well. Some of these micro learnings is what we call them. They're like 30-minute, 30-minute trainings that do a little bit of a deeper dive on some of the topics and adapt those to be more public facing as well.
Yeah, I think that would be really great. Those videos are going to be super helpful too. I just know that when someone's frustrated with their department worker, what they hear and what is said are very different things. But we want to advocate for our people, right? So we hear what they said to us. Oh, you'll never believe what they said to me, And then what do we have to help them through it? Well, we don't know what they're told, So I do think that that may help just everyone be on the same page.
Yeah, absolutely. And Ayla, you're also going to see too, in that partner portal, you'll be able to see all the call scripts, right? So you'll be able to see different types of call scripts and how caseworkers are being recommended to answer questions and those types of things too. So that's why we wanted to kind of create different, I don't want to say different versions, but there are, right? Because the way that a caseworker needs to talk through something is going to be different than maybe an advocacy group or someone who's helping navigate. So you will also have that access to see what type of scripts are being recommended for caseworkers or FAQs too.
I think that'll be really helpful too. Great. Thank you.
Really helpful feedback. Thank you so much. Just keeping an eye on time. We do have about 15 minutes. Any other questions, any other requests on member communication, outreach, supporting member with navigating these changes? Nope. Okay. Then we are going to open the floor to, oh, I missed a slide. Next session, just to update you all, next session, real quick in the topic, and then we're happy to open up the floor for discussion and other topics. For next session, we do have planned, and I hope everyone's excited to actually participate this, and we're looking to do a little bit of an outreach partner showcase. So we want to hear a little bit more from our trusted voices and our outreach partners, what you all have planned or are actively doing in helping to inform the member, educate the member, those types of pieces. even if there are plans to, right? I think it's just helpful to understand what sort of activities are going to be taking place out in the community. So that's what we've planned for the next session. We are also have a little poll prompt up there too, where I think we're interested to hear from you all as to what else you might want to ensure that we're prioritizing.